All right, now joining us in studio, this is a really fascinating interview we're about to get into. Dr. Habib Dalhoumi is a new friend of ours. I've met with him multiple times, and this guy has been an MD, and now he has changed to owning his own practice, the entrepreneurial spirit. But rather than necessarily fighting disease, it's more about preventing and anti-aging. And I think so many people that are tuned in right now care about this topic. So good to have you in here, Dr. Habib, for the first time.
I appreciate that. Thank you very much.
You know, it's interesting when we talk about things like this. Everyone's seen every gimmick online, right? All the things that you can do to stay young. Everybody wants to stay young. I mean, that's okay, but there's a lot of gimmicks.
Yeah.
Tell about, you actually were a doctor. So talk about your history as a doctor and everything you had to do there before you made the transition.
Sure. So I was trained here in the United States, back in Indiana, actually that's where I'm from, outside of Chicago. Came to California about 15 years ago. Worked for a large medical group here in San Diego for about 8 years. I was actually the associate director for a site in the South Bay. Did mostly urgent, emergent care treatment, so managing a lot of chronic illnesses that present acutely, relating to diabetes, blood pressure problems, overweight, obesity, depression, mental disorders, mood, a whole slew of things, basically.
Yep.
And the truth is, I just eventually got unfulfilled. I was unfulfilled in medicine. I was seeing people that had pretty much given up on their own bodies, were taking multiple medications, couldn't find themselves having the ability to stop smoking. Exercise was something that they wanted to do but couldn't even think about getting up to do. Pretty much gave up and would come in for acute illnesses, and it wasn't medicine that I wanted to practice. So I started working with the staff. Then I opened up my own place, focused on weight management, which was pretty easy to address. Then got into more of the preventative diseases, hormone replacement, anti-aging, added some cosmetics.
So let's go a little bit deeper on that, but I think it's interesting because you say unfulfilled. Now,
yeah.
You were paid really well. You had a
Yeah.
great job. You're married with kids. You have a home. So many people that would be in your position say, well, that's pretty fulfilling, right? So
Absolutely.
there's something in you that just wasn't inspired to do it.
Well, I'll tell you what's really interesting now. If you look at a lot of the research, a lot of American doctors are unfulfilled. It's really difficult. It's tough. We've got a lot of doctors now that are going to other fields, not even practicing medicine. You just can't practice the same way. So there is an idea of helping others. It's very unique and it's fulfilling.
Sure.
But when you have your hands tied and your mouth is tied and you're walking in the room like this, it's difficult.
Does it get to be a little bit of a conveyor belt of people
It does.
coming through, prescription?
Yeah, I used to joke and say, I'm walking in there and it's like supersize me and do this and do that. I mean, it becomes part of that. And again, there are fulfilling moments,
Sure,
but they
of
became
course.
fewer and fewer far between. And I ended up spending a lot of my discussions and talking with patients, again, back in acute care, sick management, about what they could do that didn't have anything to do with medications. So inspiring them on how to stop smoking or what they could do to change their mood without having to take a medication, or what to do to start movement in a way that maybe they didn't know about. So we didn't focus on, and I would take care of their acute illness quickly and then speak about other things. Before I know it, I got to move to the next patient. So I was able to figure out how I could kind of evolve that into my own practice.
So let's talk about your own practice. I love the entrepreneurial spirit of what you've done, especially since many could consider the position you're in as being comfortable, it's paying the bills and beyond. So to take on your own business is a big risk. You've had a lot of success with it. You have multiple shops here in San Diego.
Sure.
Correct me if I'm wrong, but the premise is preventing disease, anti-aging.
Yeah.
And of course, everyone is going to age, but aging gracefully.
Absolutely.
Explain what you're doing now and
Sure.
the things that you do to help people stay youthful.
Absolutely. So yes, a lot of it is preventative disease. A big part of what I do now is optimizing your current health. So realistically, probably a good 30% of my practice is 35 and younger. So I'm not just heading after the 40s, 50s, 60s, baby boomers or whatnot. That's a whole different anti-aging aspect. That's managing what you've already done for 40 years of your life and trying to do the best thing you can for the next 30 or 40 or 50 potentially. But a lot of the patients that I treat are in their 20s and 30s. So this is the younger population that is trying to learn about what they can do to optimize health.
So what are some of the things that we're doing?
So weight management, body composition, optimizing your body composition. So we talk about weight loss as a very general term, but what does that mean? So I focus on fat loss, maintaining muscle mass, maintaining good mood, optimizing certain hormones at any age, like vitamin D, sex hormones like estrogen, testosterone, progesterone. Understanding that, a big part of what I do is actually teaching people, look, you feel this way because of this, not because of a Prozac deficiency or something. So it's a lot of it's education, and then optimizing your health.
So as you get older, a lot of these things trail off, correct?
Correct, yes.
So when you say things like weight loss, being youthful, I think we all can understand that and know that that's what we want to do.
Absolutely,
and be.
yeah.
How do you do
Absolutely.
it, right? How do you administer in your practice?
So a few straightforward things. We think about this idea of calories in, calories out. So talking about weight management specifically.
Yep.
What I eat and how much I exercise tells me how much I weigh. Well, that works when you have optimal physiology. And we now know, based on our ancestors, that our current population, the metabolism and the youthful hormones and things that actually do work for us, burn fat and whatnot, we have about 30% decline than just our parents did. So, and by the mid-30s or so, it becomes very obvious. That is the so-called aging process for most. And if you're a female and you've had multiple pregnancies, then that just even quicker. So by the time you're in your late 30s, late 20s, early 30s, you're already aging. By 40, you're 10 years away from the so-called menopause or manopause for men. And at that point, you have virtually none of those youth-promoting hormones. So you're very close to done at all. I mean, you take a century ago, and most people didn't live past 50. Now we live to 80 in 1 century. And what is the quality of life in those last 30, 40 years?
Right. So and a lot of this is being advanced at a really rapid rate, correct? I mean, we're growing exponentially on the knowledge around all this.
Absolutely. Unfortunately, we're still really, really caught up in disease treatment, sick care management.
Right.
There's a lot of money in, pharmacopoeia. There's so much in big pharma when it comes to that right now, if a company wants to do well, they're going to try and design a drug to treat a disease. And we've got 10 of them already. Let's add another 5. When we can look at, well, how can we maintain our youth as we age? Well, best body composition, optimizing hormones that decline, replace them bioidentically. It's very inexpensive.
How long do you think people are going to live for with this new advancement?
Yeah, well, this is hormone replacement for the most part. So here, I think we're still in the age, and the stem cells is a whole other therapy.
Yeah.
We're in this scenario where if we can manage that 80, 85, but living well for the last 10 to 20 to 30, then we've done our job in this period of time. I would say in the next 20 years, 30 years, we're going to start advancing significantly with respect to stem cells, regenerative therapies, telomeres, all these things with the DNA strands, and that will extend the lifespan.
Interesting stuff. Dr. Habib, thanks for coming on the show, our health and wellness guy. Man, if people want to connect with you, inspiresd.com. You got an office in La Jolla and Mission Valley, correct?
Correct, yeah. Small office in La Jolla UTC, and then a larger clinic.
So someone comes in, do some tests, figure out where they're at?
Very simple,
Create a plan?
Interview, lab tests, a good history and physical, which is always part of medicine, and then learning specifics about that person, personalized medicine.
Connect with Dr. Habib, inspiresd.com. It's fascinating stuff, man. I just want to, you see this? I'm drinking kombucha every day now. I just want to live till I'm 200, man. Help me make it happen.
Okay.
All right.